Good afternoon. Welcome to the daily briefing in St. Clair County, where we're joined with Sam Bierman from the Health Department and Chairman Mark Kern. And Sam, you have the numbers as we've been crunching them again today, and we're just going to change your name to the number lady.
Well, that would be pretty accurate. So as of today, 64,906 St. Clair County residents have been tested, which is an increase of 836 from yesterday. We are at 5,992 positive test results, which is an increase of 57 from yesterday, and that does include both males and females from under the age of 10 up to their 90s. Our county positivity rate today is 6.8%. We are at 58,914 negative test results, and we are announcing no new additional deaths today, so we are still at 175. For those who have completed the IDPH required 10-day isolation period, we are at 5,195. For state totals, 4,119,873 have been tested. 238,643 positive test results, which is an increase of 2,128 from yesterday. And for deaths, the state is reporting 8,091, which is an increase of 27 from yesterday. For hospitalization numbers, and these are for hospitals that are in St. Clair County, currently we have 49 patients that are admitted due to COVID-related reasons, and 3 of those individuals are on a ventilator. For our regional hospitalization numbers, we are at 94 patients that are hospitalized due to COVID-related reasons, and 11 of those individuals are on ventilators. For congregate living facilities that are in outbreak status, and that is 2 or more staff or residents that are either COVID positive or who have COVID-like symptoms, we are only going to announce any facilities that have had changes. The first, Integrity Healthcare of Smithton, has 3 cases and no deaths, which is an increase of 3 cases, so they are a new facility to our list, as well as St. Paul's Home in Belleville, which currently has 58 cases and 15 deaths, and that is an increase of 1 case for St. Paul's. And I will turn it over to Chairman Kern for his update.
A lot of work there, Sam.
Lots of numbers.
Your adding machine must be about worn out.
It is, yes.
Well, I'll get you a new one. Don't give up. So we'll move into the zip code report for today. Remember, these are the COVID positive numbers in these particular zip codes in St. Clair County. And just to give you a little anticipation, we're adding a new zip code today. In 62059, we remain at 11. 62201, we remain at 221. 62203, we go up 1 to 183. 62204, we remain the same at 128. 62205, we go up 3 to 181. 62206, we go up 3 to 409. 62207 goes down 1 today to 230. 62208 goes up 7 to 361. 62220 goes up 3 to 467. 62221 goes up 3 to 566. 62223 goes up 4 to 336. 62225 stays the same at 23. 62226 goes up 3 to 628, and 62232 goes up 1 to 156. 62239 goes up 2 to 83. 62240 stays the same at 28. 62243 goes up 8 to 85. 62254 goes up 6 to 200. 62255 goes up 1 to 16. 62257 stays the same at 31. 62258 goes up 6 to 146. 62260 goes up 2 to 104. 62264 stays the same at 85. 62269 goes up 10 today to 471. 62282 is the new zip code we're adding. That's the St. Labori area, and that number is at 8. So it went up today, or 8, and it now is at 8. 62285 went up 5 to 67. So Herb, the regional positivity today remains at 9.6% according to the state's numbers. We've got our positivity at 6.8%. You know that adding a zip code in St. Laborie today, Freeburg, I think, went up significantly. It shows that it really is spread throughout the county. We need to be vigilant everywhere.
Well, I think we have one zip code throughout the county that is not reached the 5 mark yet, but if that happens, then every zip code in the county will have the virus listed in it. And, we keep talking about it every day. And last night, a lot of comments came in on the page, and we appreciate Team St. Clair following us. And a lot of the questions last night is, why aren't we blocking the naysayers on our page? Well, it's a governmental page, and people have a right to post their opinion. I will tell you, as I told several of you that text last night and private messages, if you use foul language, if you're disrespectful, those are grounds that we will block you, and we have done that to some of them. The best way as an individual, if you don't want to listen to what other people's opinions are, you can block them. But everybody's entitled to their opinion.
We'd much rather spend our time in a positive way, which
Yes.
is really helping people out, telling them where to go, giving advice, answering questions, as opposed to just responding to trolls that are out there, people that are just giving those same questions on every site just to try to disrupt things rather than try to solve this issue and be part of the team.
Well, and we've said that for 177 days now, whatever it is. We're not the medical experts that are sitting here making all those decisions. We're the messenger. We're trying to do best to keep the county residents informed. So the last thing we want to hear is the people that's got their own theory on this, that it's this, it's that. We're reporting what IDPH and people tell us, the medical experts, they've been on here, the physicians have been, the people who take care of us every day when we need them. And until that changes, we're going to continue to report the information they give us.
And Herb, our numbers are headed in the right direction.
Yes.
We're if we see our daily county positivity rate at 6.8%, we keep track of our running average. We think it's somewhere south of 8%. That's better than we've been. Consistently our numbers are headed downward, and that's the direction we need them to head.
And I think it's like we talked yesterday and the day before. We did the mask giveaway. More and more people are calling messages and say, hey, places that weren't adhering to that are now. So that is definitely, I think, is helping with those numbers.
And I know personally, more and more, I'm hearing people that I know that are going to get tested because they know someone they were in contact with has COVID. And maybe it's just me, but it seems to me that this is out there in the community even more so than I remember in the past. And maybe it's just a coincidence that I happen to know people that are having these incidents, but they're coming on far more frequently than they did back in May or June.
Right. Well, I called you the other day about one of our workers for the county, his husband that we lost, and our condolences go out to her. But there's some of the people that follow on here. Well, I don't know anybody that's had it, and tell me who's got it. Well, we're not going to tell you that. We're not going to invade anybody's privacy. But I know personally people that's had it. I've had family members that's been affected by it. Now you're saying it more and more. It seems like it's out there. Does everybody that get it, like we talked about, it's going to end up passing away? No, that's probably a small percentage that don't. But the people that we've had on these briefings, Mr. Anderson, people like that, it's not a fun thing to have, and we don't want to wish that on anybody. And we don't have to worry about that if everybody tries to be a part of the solution. And like I said, the one day, if you don't wear a mask, pat yourself on the back because you're probably part of the problem then. But sooner or later, if it knocks on your door, I assure you, you're going to say, I probably should have listened to what IDPH and the CDC has recommended, and the physicians. So that's all we can do. We're going to continue to work on these numbers, and as the chairman said, our numbers are, when we look at them, even into the 24, 48 hours in advance, because we have such a history of these numbers now, we can go back. As I said yesterday, with Labor Day coming on, I'm a little concerned about that. I just ask that everybody use good sense, follow the 3 Ws, wear the mask, wash your hands, watch the physical and social distancing, and hopefully after Labor Day, those numbers will be okay.
We need to get to 6.5% for a period of 14 days, and
And
our
we're-
restaurants and bars will open inside again. In the meantime, we're continuing to communicate with the state, asking that
Every day.
business interruption loans or grants be issued to businesses so that they can help survive this, so that when we get over all this, all our favorite places are still in business and still there for us to enjoy.
Well, and like you talked yesterday, there's not a business person out there that don't want to be open. The distributors, the suppliers, they've all contacted you, the liquor distributors, and said, hey, we want to do it.
And all the government officials that I know
Everybody.
want their businesses to be open.
Yeah, it doesn't
Your
make sense.
communities are better off when we have as many businesses as open as we can.
That's what we want. So we'll be back in a few moments with Cindy and Daisy to translate this into our Spanish communities, and then we'll be back tomorrow afternoon with the next briefing. Everybody have a good night, and please just be patient. Try to treat everybody kinder. Words don't kill anybody, but you can hurt people's feelings. You're not going to hurt my feelings because I'm here to do my job and I'm going to do that. But the people that are on here, Team St. Clair, don't deserve to be disrespectful. So keep your thoughts to yourself, and we'll all get along a lot better. Have a good night.